In this short video, I'm going to talk a little bit about non-specific shoulder pain. A lot of patients would get referred to see me in the clinic because they have ongoing shoulder pain and discomfort, and they may also have a complaint of weakness in the arm. More often than not, when we test the nerves, they all show up as normal. And this is largely because the non-specific shoulder pain is more musculoskeletal in nature rather than nerve injury induced. Obviously, it is important to have the nerves checked. What can happen over time is that there may not be one particular trigger. It may be minor traumas over time, just from use of the arm. If you do activities that involve your arm to be above your shoulder, any upward movement like this, and you're doing that repetitively over time, you may end up with discomfort in the shoulder. What can then happen is that the muscles that are causing the pain will not be used as much as muscles that aren't causing pain, and this can overall lead to an imbalance of the function of the muscles around the shoulder region. So it's important to state at this point that if your shoulder pain or discomfort came on in the context of an injury, or the pain came on very suddenly, or you are experiencing focal weakness, like you are unable to open a jar, or you are unable to lift your arm above a shoulder level, you should probably have that checked out by a healthcare professional before starting these exercises. They probably will still be safe to do and still be beneficial, but it might be better to just get that type of thing checked out. In the next videos, we are going to be showing exercises that focus on stabilizing the muscles of the shoulder, as well as strengthening and stretching the shoulder muscles.
So now that we've gone through our shoulder anatomy again and we've understood how the shoulder works, we're going to go through a series of exercises to strengthen in and around the shoulder. And these can be done about 3 times a week, or if you have time, you can do them daily as well. So our first exercise is a push-up plus, which Jennifer is demonstrating. So the idea with this is to do it on your knees and to only go about halfway down and to really focus on the scapular movement, so the shoulder blades that we spoke about. So as Jennifer bends her elbows, she's really focusing on squeezing those shoulder blades in together and activating those muscles, which would be particularly the serratus anterior and the middle traps in this movement. This exercise is called a seated row, and the equipment we're going to be using is something called a TheraBand. So these bands are great for resistance training, and you can get them in most pharmacies and online as well. So the different colours correspond to how much resistance they give you. So the yellow is the lightest form of resistance, then the red, which is slightly more, and then the green, which is slightly more than that, and then you have blue and then black as well. So we'll just start with the yellow one for this one. So Jennifer is going to show you the setup of this exercise. So you're sitting down, you're wrapping it around your feet, making sure it's nice and secure. And then you're going to pull your elbows back, focusing on squeezing your shoulder blades together. This is a great exercise for strengthening the muscles in your arms and also the muscles around your shoulder blade, which, as we explained, are really important for correct and pain-free shoulder range of movement. These exercises are called shoulder internal and external rotation, and they're really good and important exercises for strengthening your rotator cuff muscles, which, as we've spoken about, can often cause shoulder pain and issues with shoulder movement. So as you can see, I'm starting with the green band, which would be about medium resistance, but it's probably a good idea to start with a lighter resistance band, such as yellow or red, and then gradually build it up as it feels comfortable. So I'm going to show external rotation first. So as you can see, I've attached the end of the band to a secure anchor point, so I know it's not going to go anywhere when I pull on it. I'm then holding the end of the band securely in my hand. I'm locking my elbow in by my side, so the only movement is coming from my shoulder. I'm also pulling my scapula in and back towards my back, so I'm squeezing my shoulder blades together. So again, the only thing that's moving is my shoulder joint. So I'm then going to bring my arm out to the side and then back in, nice and slowly each way, and only go as far as is comfortable. And I'd recommend doing 10 to 12 reps of this exercise for 3 sets in total. So when you've done 10, you can move on to internal rotation. So this is with the other hand, but then you can turn around the other way and do external and internal rotation. So you've done both directions on both hands. So as you can see, I still have my anchor point here. I'm holding the band in my hand. I'm locking my elbow in on my side, and I'm pulling my shoulder blades back in towards each other. And then this is internal rotation, so I'm bringing my arm in towards my stomach and slowly back out. And you're going to repeat that movement like that. And you'll likely feel it working on the inside of your shoulder. So again, going to repeat about 10 to 12 reps of this, and then repeat that 3 times in total. And then when you're done this, you can turn around. You have your internal rotation on your right arm, and then you have your external rotation on your left arm. Repeat 10 times, and then you've done both directions on both arms. This exercise is called shoulder flexion or shoulder elevation, and it's a great exercise for strengthening the muscles in the front of your shoulder. So Jennifer's just demonstrating here. She has the foot over a light resistance band, and she's slowly lifting up her arm, keeping the arm straight. And she's just lifting up as high as she can while still being comfortable, and then lifting back down. It's important to note that you may not be able to bring your shoulder up all the way, and that's okay. only go as far as is comfortable. Jennifer is also using quite a light resistance band at the moment, so we'd recommend starting with a light band and then gradually building up. This last exercise is called an upright row. It's a great exercise for strengthening the muscles at the front of your shoulder and your arms as well. So Jennifer is just going to demonstrate now with some dumbbells. So keeping your palms facing in towards you, she's going to slowly bend her elbows up until she reaches about chest height and then slowly bring them back down. And just repeat this movement slowly up and down. So start at a weight that's comfortable for you and gradually build it up.